Dr. Ronnie, we will share the PPT from here.
Yes.
Okay. And
Yes,
you
no
may present then to avoid any type of network
Okay,
issues.
fine.
Okay,
Fine.
ma'am.
Yes, yes.
Same to all the speakers. Thank you.
Thank you.
वालेकुम सलाम ठीक है बोलिए यार कोई लिखा छी लिखा जो पड़ जाए क्या करें बताओ ना कल कार हमारा पड़ जाए बड़ा ही मुझे पता है बात आओ ना बात है लेकिन साल नहीं जो बोलिए यार कोई लिखा छी लिखा जो पड़ जाए क्या करें बताओ ना कल कार हमारा पड़ जाए बड़ा ही मुझे पता है बात आओ ना बात है लेकिन साल नहीं जो बोलिए यार कोई लिखा छी लिखा जो पड़ जाए क्या करें बताओ ना कल कार हमारा पड़ जाए बड़ा ही मुझे पता है बात आओ ना बात है लेकिन साल नहीं जो बोलिए यार कोई लिखा छी लिखा जो पड़ जाए क्या करें बताओ ना कल कार हमारा पड़ जाए बड़ा ही मुझे पता है बात आओ ना बात है लेकिन साल नहीं जो बोलिए यार कोई लिखा छी लिखा जो पड़ जाए क्या करें बताओ ना कल कार हमारा पड़ जाए बड़ा ही मुझे पता है बात आओ ना बात है लेकिन साल नहीं जो बोलिए यार कोई लिखा छी लिखा जो पड़ जाए क्या करें बताओ ना कल कार हमारा पड़ जाए बड़ा ही मुझे पता है बात आओ ना बात है लेकिन साल नहीं जो बोलिए यार कोई लिखा छी लिखा जो पड़ जाए क्या करें बताओ ना
Good morning all. I am just confirming the speaker.
कल कार हमारा पड़ जाए बड़ा ही मुझे पता है
Dr.
बात आओ
Ronnie
ना
Kella has joined. Dr. Murugan
बात है लेकिन साल नहीं जो
Please
बोलिए यार
take your
कोई
mic.
लिखा छी
I joined. Yes, I joined.
Okay, thank you, sir.
क्या करें बताओ
Dr. Kinle from Sikkim has joined. All I am just confirming.
कल कार हमारा पड़ जाए बड़ा ही मुझे पता
Okay,
है
thank you, sir. Kella has joined. Dr. Murugan. Dr. Sarda from Bengaluru has joined. You mic, sir.
I joined. Yes, I joined.
Okay, thank you, sir.
क्या करें बताओ
Dr. Kinle from Sikkim has joined. I am just confirming.
कल कार हमारा पड़ जाए बड़ा ही मुझे पता है
Okay, thank you, sir. Kella has joined. Dr. Murugan. Dr. Sarda from
message for the department over here that we should do, along with Ministry of Health and Family Welfare, we must do a big meeting in which we must invite the PRIs, we must invite the urban local bodies, message for the department over here that we should do, along with Ministry of Health and Family Welfare, we must do a big meeting in which we must invite the PRIs, we must invite the urban local bodies, message for the department over here that we should do, along with Ministry of Health and Family Welfare, we must do a big meeting in which we must invite the PRIs, we must invite the urban local bodies, message for the department over here that we should do, along with Ministry of Health and Family Welfare. Japan and Latin America have already eliminated dog-mediated rabies, but through their successful canine vaccination programs. Here we will have to take this up as the major activity under the One Health approach and take this upon us as a challenge. Many of the SAARC countries, except for the Maldives, they are still battling with the disease, but a general lack of ground level surveillance is what is ailing the elimination of this disease. In India, if we come to India, this disease is endemic to all states and UTs except for Lakshadweep and Andaman and Nicobar. Also, Goa has declared itself rabies free, but we need to keep a constant watch and vigil even over these three UTs and over these three UTs to see that they sustain the rabies free status. In fact, OHA endorses rabies control program. In our country, we have not been able to take up the OHA aligned rabies control program. While I had gone to attend the OHA conference in Paris this year, there was a lot of persuasion from OHA to take this up. I think now is the time that we must engage deeply with them. So Dr. Deblina, who looks after the rabies control program, and I think AHC, who's in charge of the rabies control program, should make it a point to formulate an action plan with the Joint Secretary Livestock Health, because she's the one who would be the one who would be administering this program across the country to take this up very, very seriously. So far, this department with the Ministry of Health and Family Welfare have published in National Action Plan for Dog-Mediated Disease Elimination in India. It prescribes a broad framework for combating rabies and formulating and developing state-level action plans depending upon the disease burden and the resource availability. Now, as far as the resource availability is concerned, I must say there is no resource constraint over here. The rabies vaccine is being produced in India. It is readily available. The Ministry of Health and Family Welfare supplies steady stock to all the state departments. So the resource really is not a constraint. It is only the campaign or plan for implementation which is lacking. It gives me a great pleasure in knowing that many of the states like Puducherry, Rajasthan, Tamil Nadu, Meghalaya and Mizoram have already developed their own state action plans. We must take it upon us that all the states, you must, when I talk about this meeting that I had mentioned earlier, we must prescribe upon all the states who are present over here. We must ensure that the rabies disease control action plan should be prepared, and we must follow this up along with the Ministry of Health and Family Welfare. Needless to say that the Ministry or the Department of Animal Husbandry and Dairy Development is already providing for vaccination in terms of rabies in the ASCAT program. So as I said, there is no resource constraint over here. We are also working on the inclusion of companion, that is the dogs and pets, under its ambit. The DHG has requested ICR and Karnataka Veterinary University for the development of effective and economic oral bite rabies vaccine, which has the potential of bringing new breakthrough in increasing coverage of mass dog vaccination. We have a robust health infrastructure, veterinary health infrastructure, and unparalleled technical expertise, as I mentioned earlier, and so there should be no challenge. In past, we have defeated and eradicated very many infectious diseases like the rinderpest. If we decide to defeat rabies and work with determination, I am sure that in a few years, rabies will also be a chapter in the history. I appeal to all of you who are present in this meeting, all veterinarians, all medicos and animal lovers, animal welfare activists, NGOs, and animal welfare organizations to spread the message of rabies free India so that all human beings can go out in the open without having a fear in their mind about a stray dog bite. At this point in time, let me tell you, a large number of people, may not be maximum number of people, but a large number of people today are scared of going out for morning walks because of the stray dog problem, and hence it is not only a mental fear that we carry against dog bite and rabies, but we are also endangering our bodies because we are not going out for walks. So a simple thing to which every human being is entitled is now living in a shadow of fear. We should be able to free our country from rabies. We should be able to free our minds of fear of rabies. So thank you very much, and I hope and anticipate that we will be able to take up the challenge and make India rabies free soon. Thank you very much.
Thank you, ma'am. So far, 330 participants have joined us in this webinar. Our first speaker is Dr. Sarda R. Dr. Sarda, I hope you have joined. Kindly open your mic, and please open her presentation. Dr. Sarda R. is Associate Professor in Karnataka Veterinary Animal and Fisheries Science University. Allow her. Dr. Sharda R. She joined, but now we cannot see her.
Okay, you can take.
We can take the
next speaker. Receiving content.
पिंक करो ना, इंटरनेट से मिल जाएगा. पिंक करो.
It looks like Dr. Sardar is having some technical problem to join, so we are moving to the next participants. Our next speaker is from Goa, as ma'am already mentioned in her speak that Goa is announced as rabies control state, and it is possible by the cooperation in coordination of the Goa State Animal Husbandry Department and Mission Rabies Goa. So here also we have our joint speakers, Dr. Murugan Appapillai, Director Mission Rabies, and Dr. Narendra Nayak, Assistant Director Animal Husbandry and Veterinary Science Department, Government of Goa. They will tell us their success story, how they make Goa as a rabies control state. Dr. Murugan, please unmute yourself and please share Dr. Murugan's presentation.
Yes, very good morning. Can I see the presentation, please? Could you please share the presentation?
We can hear you, sir. We can hear you.
Yeah.
We can see you.
Could you share the presentation?
Yeah, we are sharing, sir.
Please share. Very good morning to all of you. And I'm Dr. Murugan Appupillai. I'm the Director of Mission Rabies Worldwide Veterinary Service. And I have with me Dr. Narendra Nayak, Assistant Director of Animal Husbandry, Government of Goa. And Doctor, you can introduce.
Good morning, everyone. I'm Dr. Narendra Nayak, Assistant Director, Animal Husbandry, Department of AHVS Goa. Mission Rabies has started their work in Goa in 2013 and 14 in 2014, there were 17 cases, human cases were recorded. With the work of Mission Rabies, Government of Goa impressed and they signed an MOU with Mission Rabies. And from 2015 onward, there were sharp decline in cases, and by 2019, there were no human cases. I am requesting Dr. Murugan to give presentation on the work they have doing in Goa.
Thank you, Dr. Narendra Naik. And Mission Rabies started the work in Goa by 2013, and we have done 2013 and 14 trial vaccinations, and the project was on trial. And we have conducted about 20,000 plus sterilizations and vaccinations to demonstrate to the state how we are able to make it. And the government of Goa was impressed upon that. Then we started the project actually in collaboration with the government of Goa from 2015 onwards. Next slide, please. And as you see, next. Yes, after the World Health Organization came out with the solution that the dog should be vaccinated at source for eliminating rabies, and also put up a deadline by 2030. And the Worldwide Veterinary Service came out with a challenge to take this, and we started this. And after coming to Goa by next, please. Next slide, please. Yes. After coming to Goa, we start. Yes, next, please. Next, please. We started the project, and after coming to Goa, we started doing the mass dog vaccination from 2000 to 2015 onwards in an integrated fashion. Mass dog vaccination is not new to us. We are doing it for so many decades, but this project is having an integrated fashion of doing this mass dog vaccination, time bound and area bound, with app recording of Mission Rabies app. This is the technology which we are using it, combined with education and surveillance in an integrated manner. So that was able to make a big impact on this project. By 2018 onwards, we started coming to a zero rabies cases from 17, which was recorded during the initial period of the project. Then after 2018 onwards, there is no human rabies cases recorded or animal cases recorded interior. No human cases throughout the state, but no animal cases in the interior 6 talukas of Goa state. Goa is having 12 talukas. But in the border 6 talukas, we started getting the animal cases recorded from time to time. That is due to the migration of the virus from Maharashtra border and Karnataka border. Then that we were able to contain it, and with mass dog vaccination on the border areas. Next slide, please. Next slide, please. Yeah, this is the status. Before the project was started, 17 cases have been recorded, as I told you, and there was no investigation to find out the number of rabies cases or the dog population statistics. And the children's awareness was very weak, and the knowledge was very poor on rabies. The testing facility was not available, and there was a separate hospital, in fact, in Ponda for this, exclusively for the rabies cases. Next, please. Next, please. Actually, yes. After the project, now presently, next slide, please. Next slide. Yes. After the project, presently, we don't have rabies cases in human, and also the dog statistics have been generated. It is about 1.4 to 1.5 dogs are present in Goa. The children's awareness is very high. We conducted KFP surveys and then found out, and then through the education system, that the awareness has reached more than 80%. And rabies testing facility has been established right in Goa state now. Earlier, we used to send our samples to Chennai or Mumbai or Bangalore, but now presently we have our own laboratory in the government of Goa lab, and the interaction with the dog is very safe now, and the hospital exclusively for the rabies cases have been shifted to another other areas and other diseases. Next, please. Next, please. Yes, then when the project was going on, we were confused what to do. So the government of Goa wanted to check where we are. So the CDC was invited, Center for Disease Control from America, and they came. The delegation from CDC came under Dr. Ryan Wallace, and they had a share workshop, stepwise approach to rabies elimination workshop. They conducted it here in Goa, and then they declared that we are going in the right direction, and they marked a 3.5 score out of 5, and that during that time. Then after that, the government of Goa and Mission Rabies were encouraged to continue the project. Then we started continuing the project. The government also now nominated two district level and state level committees to monitor this project from time to time. Next, please. Yes, this is the model which yes, this is a model project which has been documented in Nature Communications on the 19th of May 2022. The document was authored by Dr. Gibson Andy and co-authored by me and others. And this is an effective mass dog vaccination. As I told you earlier, mass dog vaccination is not new to our country. We are doing it in an integrated fashion, and this is a GPS aided smartphone technology is used to find out where the dog is vaccinated. All the data about the dog, small stray dog or owner dog, pet dog, or the puppy or adult, all these documented, and intensive education and surveillance is supporting the project throughout the period, and the consideration of human, animal, and environmental complex and integrating each together like one health approach is the key thing for our project. Next, please. Yes. Yes. Yes, this is mass dog vaccination with the smartphone technology and covering 70% population, and then the education and awareness to protect themselves as well as to support rabies control and enhance surveillance. 24 hours hotline we have. So through that, the people have been educated to call this number whenever they come across any suspected rabies cases, and this is being attended. Next, please.
Mute to unmute.
Next, please. Yes. So the government of Goa declared the state as the first rabies controlled area during the year 2021. Next, please. Next, please.
Next.
Yes. Then the government of Goa started writing to the government of India as well as other states to take up this project, because if the other states like neighboring states are taking up, this will be much easier for Goa government to continue the project and move towards the elimination. So under this concept, this was sent to other states and other countries. Yes, please. Yes, please. Next, please. Yes. So following this positive result, and by 2021, after the declaration of rabies controlled status, and we started going for the maintenance project. That is, instead of vaccinating all the dogs in Goa, for example, vaccinating the owner dogs by door and vaccinating the stray dogs, then this project, maintenance project to control on the expenditure as well as on the manpower, this was reduced to vaccinate the owner dogs and stray dogs only on the border areas, and only to vaccinate the owner dogs in the interior areas once in a year, and that too in the centers, not going door by door. So this is a change in strategy for the maintenance project which is going on from 2021 onwards. Next, please. Next, please. Yeah, this is, for example, this is the state is now under fully controlled, and 6 inner talukas are free from both human and animal cases since 2019. And for example, the border state which we have taken up, the 3 talukas in Maharashtra and 1 taluka in Karnataka, only from these 4 talukas we have recorded last year 26 number of positive cases in animals.
All others except the speaker kindly mute their microphone.
But how is this coming? Please.
Dr. Murugan, we can't hear you now. Dr. Murugan, we can't hear you or see you. Your presentation is visible. Somehow there must be some technical problem, so Dr. Murugan got disconnected. Many thanks to Go Animal Husbandry and Mission Rabies team for sharing their experiences. So unfortunately, they are not connected to us now, so we are moving to the next participant. As tomorrow is the World Rabies Day and it's a holiday, so in many states there are regional, national and local programs are going on World Rabies Day. All these esteemed speakers, they have their own program. Even with a very short notice, they agreed to participate in our webinar. So many thanks to Team Goa. Our next presentation is from State Animal Husbandry Department, Kerala. Dr. Ronnie, please unmute yourself. We are starting your presentation. Dr. Ronnie
Hello.
Roy?
Yes.
Yeah, yes, ma'am. We
Hello,
are starting
this is
your
Sharda
presentation.
here.
Oh, Dr. Sharda, ma'am, we can take Dr. Sharda, please. Okay, please start Dr. Sharda's presentation. First one, Dr. Sharda is Associate Professor in Department of Veterinary Microbiology, Veterinary College, Karnataka Veterinary Animal and Fishery Sciences University. This microbiology lab is also recognized as the OR reference laboratory for rabies. So they are doing excellent work in rabies diagnosis, surveillance and capacity building. They are working hand in hand with all the state governments and Indian government to make rabies an important disease from a neglected tropical disease. Over to you, Dr. Sharda.
Thank you, Dr. Deblina. Good morning to one and all. But before that, can I share my PPT from my side because I have made some minor changes?
Yeah, you can. If the it's allow, it can. Please. Yeah, you can share now, ma'am.
Are you able to see that?
Not yet, ma'am. Yeah, now we can see that. Please continue.
Now, is the slide moving? No.
We are still looking at the first slide, ma'am.
I understand.
With your name.
I just got that. Is it visible now?
Yes, ma'am, it's visible.
And yeah, this for the slides moving.
Yes,
the
ma'am.
slide
Yes, yes.
That,
Yes, ma'am.
okay.
Yes, ma'am.
Okay, thank you for bearing with me. Good morning to one and all. For the dignitaries, the officials and the participants here. Thank you for inviting me for this national webinar on this important day, on occasion of World Rabies Day. I am Dr. Sharada, a professor in the Veterinary College at Veterinary College, Bangalore, in the Department of Microbiology. We also have the OR reference laboratory for rabies, which we call as the KVA-FSU CVA Rabies Diagnostic Laboratory, which is part of our microbiology department. And I am the quality manager of this particular laboratory. So I am here to brief about the capacity building activities, what we have taken up, and about the importance of rabies diagnosis. So about rabies diagnosis, I think the earlier speakers have also spoken about that. Am I audible?
Yes, ma'am. Please continue. You are
Thank you.
audible and visible.
Okay, thank you so much. So I'll not take much time on the importance of rabies diagnosis, since we all know that. Yes, we know South Asia itself is endemic for this dog-mediated rabies, and our goal is for eliminated dog-mediated human rabies. But here it's not only dogs; we have rabies being contacted from other animals also in India. Cat bite is another one thing which is usually missed out in this control program. And now, yes, we know rabies is one of the deadliest zoonoses there, and almost 99% of human rabies cases are because of dog bites, and that's how we are concentrating on these stray dog bites or eliminating dog-mediated rabies there. And unluckily, it is Africa and Asia contributing to majority of these deaths. Of these, it is said that more than 80% of these are in rural areas, and 4 out of 10 rabies deaths are usually seen in children. Children are said to be the most susceptible population. So, however, we all know we have the medicines there, we have the vaccines. So, dog-mediated rabies elimination is possible. So, that's how the UAR, United Against Rabies consortium, which has the WHO, the OA, the FAO, and the GARC have come out with the global strategic plan for rabies, looking into the global burden of rabies which is being there. So they have come up with a goal of 0 by 30 particular, going ahead with a strategic plan to end human rabies deaths which is occurring due to dog bites. So they have established a global goal and a common plan, and has given a provision for country-centric approach, which usually is on the One Health approach over there. So not taking much of your time on this. Yes, what's the major challenge which we are encountering? Yes, we know it is a vaccine preventable disease. Vaccine is prevalent since years, decades, but rabies is considered as a neglected disease. So there is limited capacity with respect to diagnosis and reporting of the diseases also. So most of the human veterinary rabies are underreported. So thanks to the initiation of NAPRE, where funding is being provided now for vaccination of stray dogs. And other than this, yes, we have, we need to focus majorly on this control program. And as Secretary Ma'am suggested earlier, increase more awareness about this, because as we come across when we go about with field visits, we get to know that many people are not aware of how to go about with it or where to go for the post-exposure prophylaxis. And though we have fragmented dog vaccination programs which have been happening since years, still the disease has been prevalent. So in line with the United Against Rabies Consortium, our government of India also has come out with the National Action Plan for Rabies Elimination on a One Health basis. And among the animal health component, yes, one of the major things is capacity building and training, along with the mass dog vaccination and strengthening the diagnostic facility and awareness, increasing the awareness over there. So diagnosis of rabies is the basis. So whenever we say we have to go ahead with control programs over there, we need to have a proper data about the prevalence of the disease. So, and timely and confirmatory diagnosis is very, very important when you're going ahead with prevention and control. And with this, I am sharing what little we have done from this rabies diagnostic laboratory over here. This is the mandates of our rabies diagnostic laboratory, in addition to diagnosis or going in for serosurveillances. So we also offer antibody titer testing for international movement of pets. We are associated majorly with the development of in-house diagnostics. Okay, with the diagnostics being quite, actually we have some problem with resourcing the diagnostics also. And in case we have locally developed or indigenously developed validity diagnostics, this will surely help us in our control programs. So in addition, yes, one of our major mandate is capacity building, where we concentrate on human resource development. So when we say capacity building, we are associated with both on-site or regional or even virtual training programs have been conducted. And this training program majorly concentrates on the collection of the sample, the submission and going ahead with the diagnostic tests, the antigen detection methods or the molecular detection methods, in addition to giving importance for all the healthy and safety procedures and biosafety and security awareness. So this is the method which we usually tried them on, the occipital foramen method. The major inhibition with veterinarians initially was about the sample collection, where they had to break open the head, which was a cumbersome procedure. Now with this technique, it has been made very, very simple. And after the training programs, we have seen a significant impact from our trainees who are there in the field. So we have been getting feedback from all those who undergo training with us, and the inflow of samples to our laboratory has also increased along with these training programs, which we have been initiating since years. And these training programs particularly started with our OE twinning program. We had twinned with the reference labs with CDC Atlanta in US and the APHA lab in the UK, which are the reference labs there. So the major mandate was strengthening rabies diagnosis across the country in India. So with their support, we had initiated these training programs. Further, we have national training programs which has been going on with the support from NCDC, the Ministry of Health, and also programs which have been supported by the DAHD and the Commonwealth Veterinary Associations also. So during the pandemic period, we had this virtual mode of trainings which we had conducted because the movement restriction was there then. Once it was lifted off, we continued with the hands-on experiences for the trainees. So these are some glimpses of the trainings which we had conducted and the increase of inflow samples. This bar diagram refers to only the samples which we have received in our laboratory from Karnataka itself. Only restricted to Karnataka, though we have received it from many. Though we have got 71% positivity, I would like to say that majority of the samples here are suspected rabies samples. So therefore, we see this 71%. And not, as I told you, it's not only the training what we provide in our lab, we also move to other institutes or colleges, or we conduct pre-conferences, workshops over there, training people majorly on sample collection, process, packaging and transportation to the nearest lab. And wherever possible, we have been trying to train them on the reference test, the ORFO test, that is the direct fluorescent antibody assay, which we have been practicing, and even the lateral flow assay, that is the rapid antigen test, which can be used in the field conditions. So our lab is also supporting students across the country who are working on rabies for their further research necessities, whatever is required. And being a OR reference laboratory, our responsibility is even towards the South Asian and the Southeast Asian countries. And because we got the recognition of OR reference laboratory in 2020, that is in the peak of the pandemic. That was when we initiated the virtual training programs for the SAARC countries and also national training programs. This was followed by a training program in combination with Mission Rabies. So the OA RRAP, the regional representation for Asia and Pacific, is at Japan, Tokyo. So with their support, we had this diagnostic and serology trainings, and the mass dog vaccination trainings were conducted in with the support of Mission Rabies. Dr. Murugan was there as the earlier speaker. Yes, they were one of our major supporters also. This was for the SAARC, not only for the SAARC countries, the others also. And yeah. After this international training programs also, we got good feedback. The impact of the training was very, very immense because of the ease of the sample collection and the availability of the rapid antigen test kit. So they were able to diagnose it at the field and further send it to the nearest laboratory for confirmation, not restricting only to the Southeast Asia. So with based on the request from the other countries, we had trainees from Africa also participating along training programs here with the support of the Commonwealth Veterinary Association. And recently Russia has been approaching us to train them. So we are regularly involved with this training programs where we majorly train them for the diagnostic surveillance. So we also provide diagnostic facilities for the countries. So this was the recent one, thanks to the DAHD, which gave us permission to import for the Sri Lanka to send the samples to our laboratory over there. We were able to go ahead with confirmation and do a molecular epidemiology study to see whether there is any variation. And luckily in India, it's only the Arctic 1 lineage and the Indian subcontinent lineage which has been circulating. The Tamil Nadu and the Kerala usually has this Indian subcontinent lineage, whereas the other states usually you have the Arctic 1 lineage of the virus. But luckily, whatever the virus which is present, yes, they are. All our diagnostics will be able to detect them. And we also have, like all the rabies laboratories, reference laboratories have a laboratory network which we refer to as the lab network. Similarly, in the South Asia with the national lead laboratories, whichever are being present, we have been connected and we have initiated the South Asian RABNet, Rabies Laboratory Network. So, which is being supported by the OA RRAP, the regional representation, and also by this laboratory in Bengaluru. So this is the connectivity which we were able to develop within India and also in the Asia by training programs majorly and not restricted. We say rabies is a major example for One Health. Yes, not only in India, even globally, the OA and the WHO regularly have these collaborate meets over there to decide about how to proceed with major rabies control strategies. And this is Dr. Islur, who is our laboratory director, who is regularly part of these RabLab networks. Other than training, so we are not only restricted to training or diagnostics, so we are also trying to develop cost-effective diagnostics over here with respect to the OA standards, also equivalent to the OA standards, so that we will be able to use them for our elimination programs over there. So our laboratory director was part of the contributing to the National Action NAPRE document there, National Action Plan for Dog-Mediated Human Rabies Elimination, and also for the SAPRE. So in addition, country partnership programs are also going on because we are a Goa reference lab. We are expected to support the countries in Asia, South Asia and Southeast Asia particularly. And with the help of our Mission Rabies, we were able to initiate rabies elimination efforts in Bengaluru city particularly, because we are located over here. We used to get many samples suspected for rabies from the stray dogs through the BBMP, the Bengaluru municipality over there. And with the support from Mission Rabies, we were able to go in for a dog population estimation, and regularly vaccination programs have been going on since 2021 for the stray dog population in Bengaluru. And the effective of this is very, very interesting. The number of suspected samples, what we were receiving to our lab from the BBMP has drastically reduced. So initially it was somewhere around 35 to 40 samples what we used to receive monthly. Now it is just in single digits. So the effectiveness of vaccination is well proved over there with this small pilot project which is being done here. We are also part of the awareness programs what we regularly conduct, not only restricting for Rabies Day, but all through the year. This is one glimpse of the World Rabies Day which was conducted last year. So I would, with this brief introduction about what we have been doing with respect to capacity building, yes, I endorse that. Focusing addressing the disease in dogs particularly will surely help us prevent disease in humans. And this year's theme of Rabies Day is very, very typical, breaking rabies boundaries. Yes, we have been doing many activities with respect to controlling rabies, but yes, there are certain limitations, there are certain challenges or perceptions. We need to break through all these boundaries and take a very big leap if we have to reach Rabies 0 by 2030, particularly dog-mediated human rabies. Thank you. With this words, I would like to end my talk.
Thank you very much, Dr. Sarda, for sharing with us all the activities of Rabies War Reference Lab. Thank you very much. Now, I would like to request our next speaker, Dr. Ronnie Roy, Assistant Director, Department of Animal Husbandry of Kerala, to enlighten us about the activities of State Animal Husbandry Kerala in controlling rabies.
आप बोलिए.
Okay,
She can do the concluding.
yeah, please, yeah, Dr. Ronnie, please excuse us for a minute. Our HC sir has to go for leave for an important meeting. So before leaving, I will request HC sir to give her remarks. His remarks.
Concluding remarks will be given by JSLH.
ठीक है, हो जाएगा मेरा. I'm audible, right? Okay. Yeah. Most. And all the participants who joined across the country, my colleagues from the WA reference laboratory, universities, ladies and gentlemen. I just touch upon the few critical issues which are so very important for rabies control. First thing first, states has to report rabies cases on time, every month, regularly, in the given format to the DSD. That is one most important thing which are lacking, and without that we will not be able to ascertain that how many cases are occurring in animal, either due to dog bite mediated or otherwise. It is so very important. So this is the first thing to all the state government. Second thing is that, you know, all of us must understand two important things for dog control. There are two facets of rabies control. One is the dog population control, and second is vaccination. Most of the time what happens that we do vaccination very efficiently and effectively, but we somehow fall apart when it comes from the population control. Because the population control, as Secretary has clearly told, it comes under the purview of mostly the local municipal bodies, and that population control somehow become ineffective or less effective or not properly effective, which leads to the increase in the population. If you see around our neighborhood, if you see around our municipalities, even yesterday, ma'am, I visited Chennai, and I visited their hospital, which is one of the very good hospital for the veterinary clinic. They get every day nearly 500 cases only to dog and cat. And people are standing in queue. But the one of the major concern is that stray dog population, even within the veterinary college campus and other places. So just to emphasize that, the dog population control is one of the major aspect of any rabies control program. Second thing is vaccination, timely vaccination, and I'm sure that vaccination should go in such a way, which example has shown already by State Goa. There would be some concern and question by many of you regarding the why we are not allowing the use of BAIT, oral rabies vaccination in India. There are some discussion, and there is a need for further discussion. As of now, there is a WHO guideline. They have given some guideline. WA also given some guideline, but we need to have some broader stakeholder consultation that whether India is ready for allowing the oral vaccination in India or not. Final thing, what Madam has already pointed out from the department side, you know, all the disease control program, we have a action plan, and we generally get it endorsed by OHA. We have got our program endorsed for FMD. We have got our endorsement under preparation for PPR. For dog, ma'am, there are two action plan would be there. One is the dog population control. There is a one action plan, and there will be rabies control. There will be another action plan. Fortunately, one Miss Monal, who also worked with us in our some capacity in the ASD. So, what would be important that if we can ask, designate one person as a nodal person for the preparation of the document, who will be exclusively involved in the preparation of the document, sharing that document with the WOHA, because you also appreciated during our program many a time the question come back and go forth. They need a kind of a dedicated this thing. So if we do that, and we try to develop some, but this needs a kind of effort, so that would be so very important. And doing that also would be requiring some kind of a stakeholder consultation with the states. We have to look into our other stakeholders like NCDC, because our program should be aligned with our national rabies control program. As you said very rightly, madam, that as we want to make our country or the world or the region rabies mukt or rabies free, it is only possible if we control the dog mediated rabies. This is the majority concern, and that also would be only possible if we have an effective mechanism of dog population control. I have talked in a department regarding having some innovative technology like some nanoparticle or some other mechanism, non-surgical methodology like reshug and other thing, which would be maybe now is the time that we put forward such alternative methodology other than simply going by surgical method of animal birth control. And also one important thing is that instead of doing control of both male and female, we have to also think of that male, if we do target one particular sex, say we sterilize all the male, that also create a lot of effort. So these are the two few issues I wanted to highlight, and I would like to congratulate all the states, particularly Goa. I recently visited Goa also. I attended one or two meeting with the Goa state, and they are also doing now targeted vaccination in the border area with the Karnataka, because they have a lot of stray animal or stray dog come from other states. With this, I conclude, and I'm sure, as we have seen earlier also, with your initiative and with your guidance, we have done many other program. I'm sure this program also will be successful. Thank you. Jai Hind, Jai Bharat.
Thank you very much, sir, for your kind words. Our next speaker is Dr. Ronnie Roy, Assistant Director, Department of Animal Husbandry and Kerala. Please share his PPT, her PPT. She will present on the best practices by State Animal Husbandry Kerala in controlling rabies in the state. You are audible, Dr. Ronnie. All others are requested to please mute their microphone.
Thank you, Dr. Javelina.
I think it's Tamil Nadu.
Except Karnataka. Except Dr. Ronnie, all other please mute their microphone.
May I begin?
Yeah, please, ma'am.
Okay. So at the outset, let me express my gratitude to the Ministry of Fisheries, Animal Husbandry and Dairying, Department of Animal Husbandry and Dairying, for having accorded the state of Kerala an opportunity to showcase the control measures taken against rabies by the Animal Husbandry Department. So the theme for World Rabies Day 2024 is Breaking Rabies Boundaries. Hence, we too have shared a title, Beyond the Bite, Towards a Rabies-Free Kerala. Yes, as we all know, rabies is a fatal zoonotic disease, and around 20,000 reported deaths are seen annually from rabies in India. India is endemic for rabies and accounts for around 36% of the world's rabies deaths. And statistics also show us that up to 60% of the deaths are in children below the age of 15. And over 95% of deaths in India are from dog bites. May I have the next slide, please? Coming to the Kerala context, Rabies remains a challenge in the state of Kerala and is considered as a major public health issue. Now, in the year 2022, there was a series of rabies deaths in humans due to dog mediated rabies. And this was a wake up call for the state. In line with the National Action Plan for the elimination of dog mediated rabies, steps are also being taken to reach the goal of zero by 2030, which is the global strategic plan to eradicate rabies. So, the message that rabies is 100% preventable and yet 100% fatal is the challenge that needs to be addressed. So, the Animal Husbandry Department in Kerala has been spearheading the cause with the collaboration of the local self-government department. So a multifaceted approach involving public awareness, vaccination programs, and community engagement was planned. Next slide, please. It was for the first time that stray dogs were vaccinated in Kerala in a campaign mode. September was declared as a vaccination month for rabies. So wide publicity was given throughout the state to promote the vaccination drives. So it was decided to have a month-long campaign followed by annual revaccination, and stray dogs were to be vaccinated in the campaign mode, and own dogs were vaccinated in the static institutions of the AHT. May I have the next slide, please? So if you notice, I'm introducing a timeline. So previously it was September 2022. Next we come to March 2023. So as part of the CSR initiative of the Indian Immunologicals Limited, which is a subsidiary of the National Dairy Development Board, the Rabies Free Kerala project was introduced. It was started in March 2023, and this was to support the state government in its rabies control programs. May I have the next slide, please? Oh, yeah, it's correct. Sorry, previous one, please. Sorry. Yeah. So here the project was implemented through an Animal Welfare Board of India approved animal welfare organization, namely CAWA. And it stands for Compassion for Animals Welfare Association. So the initial vaccination coverage was within the Trivandrum Municipal Corporation area, and the initiative was to cover stray dog vaccination, ring vaccination, and patient counseling for dog bite victims in the corporation area. Now, due to the successful implementation of this project, there were several requests made by the panchayats in the nearby areas, and the vaccination campaign was extended to the panchayat districts as well. You previously saw the NDDB team with the Kawa Rabies Control Task Force. So next we did the MOU with Worldwide Veterinary Services in June 2023. So the Animal Husbandry Department signed this MOU for technical and technological support. Now, capacity building was the main point that they had considered. This was for the smooth implementation of the vaccination drives, training of the dog catchers and vaccinators. There were several comprehensive training programs and seminars conducted throughout the state. In addition, special training sessions were conducted for the AHT veterinarians and paravets in Trivandrum, Kollam, Ernakulam, and Malappuram districts. This was on the use of the WES app, which we had used during Mass Dog Vaccination 2023. This was for recording the data of the vaccinated dogs. I have the next slide, please. Here we see our Honorable Minister for Animal Husbandry with the Director of Education, Mission Rabies, Dr. Murugan. I must mention here that our Minister has been spearheading this cause, and she has taken a very keen interest in having the control measures for rabies implemented in the state. Next slide, please. Patient counseling. Now, this was also a point that was taken up by CAWA. This was to address the emotional well-being of the traumatized dog bite patients. Now, from 2023 onwards, 11,229 patients from the General Hospital and the Government Medical College have been given counseling. Now, the emphasis was on follow-up of the post-exposure vaccination so that completion of all the required doses were done, and also educating the patient on safe practices with dogs. That is, how to approach an unfamiliar dog and also how to spot signs of aggression in dogs. Next slide, please. So you can see here the patient counseling sessions going on. May I have the next slide? Awareness campaigns and education. Now, seminars were conducted for the officials of the Okay, sorry. So, understanding how rabies spreads, the timely treatment protocols available, and the need to access post exposure prophylaxis are very crucial for the effectiveness of the control programs. Now, these seminars were conducted for the local authorities, for the officials of the local authorities. The Rabies Free Kerala project is being monitored by a joint steering committee with the under the chairmanship of the district collector. So the district collector had given this instruction that the local authorities should be first well versed with all the control measures, with the ABC rules 2023, and unless they are aware of this, they will not be able to advocate the vaccination drives within their communities. So we have conducted these seminars for both the authorities and for the community regarding rabies and the need to do the vaccination drives. So leaflets were also distributed in both vernacular language and in English. Next slide, please. Here we see an awareness campaign on World Rabies Day. This was conducted in the Government College of Nursing. Next is the community engagement. Next slide, please. So community members were given information on rabies prevention, and this was to encourage them to participate actively in the vaccination campaigns and also to practice responsible pet ownership. Now, education can go a long way in helping dispel the myths and fears surrounding rabies. So thereby a more rational and informed response will happen for and towards animal bites. For this, Mission Rabies, CAVA, and other organizations like the Indian Veterinary Association have played a very key pivotal role here. We have 578 community outreach sessions held since 2023, and 24,101 community members have participated in these sessions. Next slide, please. We can see a community outreach program here conducted by CAVA, Mission Rabies in Trivandrum. Next slide, please. The education strategies for school children. Now, the statistics have shown that children below the age of 15 are most vulnerable to dog bites. So, on a special note, based on the request from the Animal Husbandry Department, the General Education Department had issued orders to permit Mission Rabies to conduct rabies awareness sessions to children below the age of 15 in all the schools of the state. This was a landmark order, and since 2023 onwards until date, 938 schools in 7 districts of Kerala, namely Trivandrum, Kollam, Thrissur, Palakkad, Ernakulam, Kottayam, and Alappuzha, have been covered. And talks have also been held with the SERT to consider the inclusion of a topic on rabies in the school syllabus. I had the privilege to accompany Dr. Murugan, Director of Mission Rabies, to have the talks with the Director SERT. And he was very positive about including the topic on rabies. So once this topic is included, all students will be aware of rabies, its control, and its prevention. So since August 2023, 117,120 students have attended these sessions. May I have the next slide, please? So here is a school session going on for the primary students. And next slide, please. This is a school session for the high school students. Next slide, please. As mentioned earlier, no control measure for rabies will be successful without confirmatory diagnosis or testing facilities. So the Animal Husbandry Department in Kerala has its own network of laboratories within the state, which are well equipped to confirm rabies using the direct fluorescent antibody technique and PCR. Now, surveillance studies are also conducted. This is by sero monitoring to assess the immune status of the dogs prior to vaccination and post-vaccination using the techniques of RIFIT and quantitative ELISA. This also helps to find out the herd immunity status in the vaccinated dog population. Now, the State Institute for Animal Diseases, along with the 4 regional disease diagnostic laboratories, serve as a hub and spoke network for the state. I may point out that the State Institute for Animal Diseases, Avian Disease Diagnostic Lab, and the Regional Disease Diagnostic Lab in Palakkad are all NABL accredited with BSL level 2 and 2+ facilities. Thank you. Next slide, please. We come to the outcome of the mass dog vaccination 2022 and 2023 drives. Now, as per the 20th livestock census in 2019, the dog population figures for the state. In case of own dogs, it was 8.3 lakhs, and in stray dogs, it was 2.89 lakhs, coming to a total of around 11.3 lakhs. Now, the intended target was to cover at least 70% of the total population during the mass dog vaccination campaign. So, and continuous vaccination in this way for 7 days, for 7 years, was intended to bring down the rabies incidence in the state. We were following the Goa model of rabies vaccination. The mass dog vaccination strategies were according to the Goa model. Now, however, desired results were not obtained in the first MDV drive in 2022. And as we had shown earlier, in 2023, we had roped in the services or the expertise of the NGOs like Mission Rabies and also CAVA. And here we were able to cover 13% of the total population during the campaign period. And 34% of the total population was vaccinated during the financial year 23-24. Next slide, please. We'd like to present the data of CAVA and Mission Rabies also in the Rabies-Free Kerala project. A total of 16,594 dogs were vaccinated from May 23 till September 20th, 2024. Now, this itself covered 35% of the stray dog population in the district. 47 ring vaccinations were also carried out on the request made by local bodies and AHD based on the dog bite incidences. I must say the role of NGOs in the rabies control program has to be highlighted. Next slide, please. Next slide, please. So, since we did not get the desired results, our respective director suggested that we revise the rabies vaccination strategy. And based on that, in order to achieve better vaccination coverage for stray dogs, we had a meeting with all the major stakeholders like the local self-government. We had Mission Rabies from UK and India. We had the veterinary universities. We had the local self-government joining in. And based on this, we had some discussions and the stray dog vaccination strategy was revised. Based on this, a stray dog vaccination henceforth will be conducted throughout the year. The intention is to saturate locality by locality once every year in the district, and this will enable us by engaging the vaccinators and dog catchers throughout the year, and this will be funded by the local bodies. Campaign mode would also continue. However, it would be restricted for owned dogs in the static institutions of the Animal Husbandry Department. So this was one of the major strategy revision that we had done this year. May I have the next slide, please? So the patient counseling sessions, which were initiated previously by CAVA, have now been upgraded according to the IBCM protocols, that is the Integrated Bite Case Management protocols. Now, this is a more One Health approach. And here what happens is that we have a more comprehensive approach to handling dog bite incidents, focusing on the prevention of rabies and ensuring effective medical and psychological care for the victims. This again involves coordination among various stakeholders, including healthcare providers from both the medical and the veterinary departments, public health officials, and community organizations. Next slide, please. Next comes the Rabies-Free Kollam project. Now, owing to the success of the Rabies-Free Trivandrum project, the district of Kollam, which is adjacent to Trivandrum, has also started the Rabies-Free Kollam project in August 2024. That is last month, and this is by replicating the Trivandrum model. So once again, the role of NGOs in the rabies control measures needs to be highlighted and acknowledged. May I have the next slide, please? Next slide, please. Yes. So dog population management in the form of animal birth control programs and vaccination strategies in the form of mass dog vaccination drives are the two fronts in the fight against rabies. With the support and funding of the local bodies and the technical guidance of the Animal Husbandry Department, in the state we have 15 ABC centers functioning correctly, and all these are with the Animal Welfare Board of India approval. 15 more centers are in the final phase of construction. Some have already applied for the AWBI approval and are waiting for it, and 5 more are in the pipeline. Now, why we are unable to establish more centers? The main reason is the public resistance against setting up of ABC centers. Even if the department or the local self-government is willing to, I mean, we have the land for it, we have the funds for it, but the public resistance is huge. Now, I may also make a mention that the rabies-free Kerala project is reviewed regularly by the Secretary to Government, AHD, and just 2 days back, we had submitted from Kava a proposal to mobilize a porter cabin with an operation theatre and kennels, with assembly unit kennels, which can be assembled and disassembled. And this is to cater to the rural areas. So this is just in the pipeline now. Talks are being held between the HD, local self-government, Indian Immunologicals, and Kava. So if this proposal goes ahead, Indian Immunologicals have already given a word that they will be willing to support us. And why we are keen on this is that this is not a permanent fixture in any area. So we presume that resistance from the public would be less. Next slide, please. Dog adoption campaign. Now, the urban local bodies are conducting dog adoption campaigns also. This is for the rehoming the friendly street dogs. And animal welfare organizations like People for Animals, Street Dog Watch Association, their foundation, they also conduct regular adoption drives. So public awareness is a need of the hour. And also popularizing indigenous breeds or the indie dogs are also done through these NGOs and organizations like the Indian Veterinary Association. Next slide, please. Next slide, please. Coming to the conclusion, Kerala's comprehensive approach to confronting rabies combines vaccination, public education, and effective healthcare services. Now, this is by collaboration between the Animal Husbandry Department, Health Services Department, local self-government, and the NGOs like Mission Rabies, Worldwide Veterinary Services, and Kava. The state is making significant progress in reducing the incidence of rabies and protecting public health. However, continuous efforts to enhance awareness, accessibility to vaccines, and management of stray animals will be crucial for sustaining this progress. And the last slide. Next slide, please. So I kept this as the last slide as an acknowledgement to the services rendered by the Kava team members, which have shown that responsibility indeed comes with compassion. Thank you. Thank you very much.
Thank you very much, Dr. Ronnie. Our next speaker is Dr. Thinle N. Bhutia, Additional Director cum Program Coordinator, SARA. Dr. Thinle, kindly unmute yourself. Please share Dr. Thinle's PPT. SARA is Sikkim Anti-Rabies and Animal Health Program. It's a statewide animal birth control and anti-rabies program initiated in 2005. Dr. Thinle?
Yes.
Yeah, please unmute yourself. We are running your PPT. By then, I will like to say a few words about SARA. This SARA is the first government-sanctioned initiative involving animal welfare and public health sector in India. It's a collaborative project between Animal Husbandry Department of Government of Sikkim, a France-based NGO foundation, and an Australian-based NGO, Vets Beyond Borders, and also a Sikkim Society for Prevention of Cruelty of Animals. So, let's listen to Dr. Thinle N. Bhutia on the experience they have in Sikkim in controlling rabies. To you, please.
Yes, very good one. Good morning to, good afternoon indeed to one and all. Next slide, please. I'll, without further ado, I'll straight away make a start. Yeah, so much, I think Dr. Deblina have said most of the things, but the program without a background of any program, it will be improper for me to begin with. So this particular program was started way back in 2005 when there was chaos and pandemonium in the state of Sikkim. dogs were brutally shot dead. There was no other option, to control rabies and stray dog population. In the name of control of stray dogs, thousands of dogs were slaughtered. So there was a strong, response and a request from the public of Sikkim that some kind of a humane dog population control program should be started in Sikkim. So it was created based on that request. So three of us, the government of Sikkim, under the aegis of Department Animal Husbandry, Vets Beyond Borders, and the Foundation Vijay Bardo and SSPCA, we got together and began this program. And started in 2005, due to our success and commitment of the government, the program was later on in 2009, a separate division under the department was created. And it has four main components, as you can see on the slide: dog population management through surgical sterilization and mass dog vaccination campaign, and provision of medical surgery hospital care to sick and injured stray animals, and animal welfare.
Dr. Thinley, we cannot hear you. Is he unmute? Dr. Thinley, we cannot hear you. Can any other, Dr. Ronnie, if you are still with me, can you just unmute us and speak once? So we can diagnose the problem from which side?
Things like now I went wrong.
Yeah, now I think the sound is back. We had a technical glitch. Now again, I would like to request all the participants, please be on mute mode. Dr. Karma Tenjing, please mute your microphone. Dr. Thinley, we will resume your presentation, please. Dr. Thinley, you are still with us? सबको तो नहीं कर सब Dr. Thinley, are you audible? Dr. Ronnie, are you audible?
Yes, madam.
Acha, okay. Kella confirm that we are audible. Dr. Thinley, is it still with?
Yes, madam. It is audible. Yes, madam. Audible, ma'am.
Unfortunately, we had a technical glitch. So now it is being resolved. Please be with us for a few minutes. Acha, Dr. Thinley is reconnecting. Please be with us for a few minutes. Please play the PPT of Dr. Thinley. Except the speaker, all others are requested to kindly mute themselves. It seems Dr. Thinley is experiencing some technical issues, so we are moving to our next speaker, Dr. Simmi Tiwari. She is Head Center for One Health, National Center for Disease Control, New Delhi. She will give a presentation on One Health approach for rabies control based on National Action Plan. Please run her PPT. Dr. Simmi, please unmute yourself.
Can you share from our side or?
Yeah, we can hear you. We can hear you. We can see you. Yeah. Please start the PPT.
So, very good morning to all of you. Thanks to Department of Animal Husbandry, Ministry of Agriculture, Fisheries and Dairying for giving me an opportunity to present the status update on National Rabies Control Program. I congratulate to hold this important webinar on this event, the World Rabies Day, and the theme for this year is breaking rabies boundary. So which is very apt for the issue, as we understand that the rabies is an ideal case to showcase the One Health approach in action. So I would just quickly run through for the participants that what all we are doing in the National Rabies Control Program and to operationalize the National Action Plan for elimination of dog-mediated rabies from our country. Next slide, please. So why we should aim for the rabies elimination? We understand that it is a 100% fatal disease, but fortunately it is preventable because we have the rabies vaccine effective both for the human as well as for the animals. And we understand that the rabies is a critical issue, and to this the India is a big contributor to this disease. Worldwide 59,000 deaths are being reported, and of these, two-thirds are being contributed by alone Southeast Asia region and approximately mostly from the India. Most of the animal bites in India are caused by the dogs, and there is a huge economy which is being lost due to this issue to the amount of US dollar 8.6 billion per year. And India also is having a significant loss to the extent of 2.85 million US dollar, and 1.3 million delis are lost due to this disease. Many countries, they have achieved the status of rabies free. Even the neighboring countries of the India, like Bhutan, they are doing very good in the rabies field, and also the Bangladesh is having a very good plan to address this issue. So we are also trying to curb this menace from our country, but we know that our country is full of challenges with a huge trade of population. But we congratulate and we are fortunate enough that we are having a One Health approach for this disease. All the stakeholders are on a single platform. And next slide, please. So with this issue, with this One Health approach only, way back in 2021, the National Rabies Control Program, National Center for Disease, launched with One Health approach National Action Plan for Dog-Mediated Rabies Elimination to have a vision to achieve zero human deaths due to dog-mediated rabies by 2030. And the mission is to progressively reduce and ultimately eliminate the human rabies from India through sustained mass dog vaccination and to have appropriate post-exposure treatment for all the animal bite victims in the country. Apart from this, other strategies are also being enlisted in the National Action Plan for Dog-Mediated Rabies Elimination through human health component and the animal health component. Next slide, please. So this is a snapshot wherein we can showcase where we are showing the commitment from all the 6 line ministries to achieve this goal of making India as a rabies free by 2030. National Action Plan is a broad strategic framework for combating rabies in India for the states and stakeholders to develop their own state action plan specific to their geographical needs and specific to their human and the animal environment. So I would like to apprise the entire participants in this webinar that Meghalaya is another state wherein I have just joined, that they have launched their state specific action plan, and at the same time the regional workshop is going on in Delhi, wherein 6 states are there being invited to formulate their state specific action plan. On this World Rabies Day, there are 3 states, those who are going to launch their state action plan. Meghalaya has already done it. I have just a part of their activity. And tomorrow, Tamil Nadu and state of Mizoram, they are again going to launch their state specific action plan. Next slide, please. So this is a multi-stakeholder engagement for operationalization of NEPRE. As I have told that 3 regional workshop has been undertaken, 14 states have been covered, 2 states, Puducherry and Rajasthan, they have last year they have launched their state specific action plan. Next slide, please. This is a slide which is showing a brief progress about the National Rabies Control Program. Many activities are being undertaken. This is just a slide. We ensure financial assistance under National Health Mission for procurement of anti-rabies vaccine and anti-rabies serum to all the states through National Free Drug Initiative. Approximately 98.75 crores are approved under NHM. So this is a yearly budget. Approximately 100 crores are to the tune of that is being spent and given to the states for procuring anti-rabies vaccine and anti-rabies serum. So we can see that is a huge financial responsibility towards central government to provide the rabies biologicals for the animal bite victims. We are ensuring the state-wise stock monitoring of anti-rabies vaccine and anti-rabies serum through DVDMS portal, and also now we are trying to undertake the beneficiary tracking by linking of the availability of this stake through the EVIN portal. Apart from this, there is a very important activity to establish the model anti-rabies clinic across the country. 294 model anti-rabies clinic has been established in 25 states. So these clinics are ensuring 24/7 availability of anti-rabies vaccine and anti-rabies serum for the dog bite victims. Apart from this, strengthening surveillance of the dog bite victims and rabies deaths, undertaking capacity building exercises and laboratory strengthening. These are the another activities. Human rabies has been declared as a notifiable disease in 2021. The animal husbandry, they are also the rabies is notified in the animal sector since many years, but human rabies has been made notifiable in 2021. So far, 23 states have declared rabies as a notifiable disease. Animal bite and human rabies cases, they are a part of IDSP IHIP surveillance network. Center for One Health has established a network of 64 institutes from the various sectors, out of which 9 laboratories are particularly dedicated to undertake the diagnostics of rabies in humans. Apart from this, standard IC training modules and learning videos has been consistently created on the various aspects of this disease, uh, both from the general community, and these learning videos, they are based on the target audiences as per their need. So this map is showing the laboratory network of rabies across the country. Next slide, please. Uh, Apart from this, one of the important activity which we are taking with the help of UNDP to establish the helpline for the animal bite victims. The helpline number is 15400, and this is on pilot basis initially in 5 states: Andhra, Madhya Pradesh, Assam, Delhi, and Puducherry. And on this helpline, any beneficiary from the field, they can dial on this number and they can get to know what exactly has to be done in the event of animal bite, and from where they can get the anti-rabies vaccine and anti-rabies serum. This was a very intensive technical exercises, because we were supposed to map out the availability of the stock in the various health facilities across the country. We are also trying to map the animal husbandry or the corporation's assistance towards from this helpline. We have requested Department of Animal Husbandry to provide the details, and we are on the job, and we are hopeful that in the next few months, if there is any suspected dog is there, and if any common man wants to remove that dog because of suspicious behavior of that dog from the street, they can reach out to the concerned authority through this helpline. Apart from this, National Center for Disease Control, Center for One Health has been able to launch the National Rabies Control Program website. This was launched on 12th March 2024, this year only. And this website is providing a data portal to enter the activities both for the human health sector as well as the animal health sector. And also this website is providing a digital platform to showcase any activity by any partner across the country in this field. And this is a ready reckoner to download any kind of technical guidelines for the states or the districts or any of the field functionary. Next slide, please. Rabies Free City initiative is in itself a part of the state specific activities. Rabies Free City initiatives are being targeted in the selected tier 1 and tier 2 cities across the country. And for this, we have been partnering with the PATH, which is an international NGO, international development partner, and we would like to thank that they are doing wonderful in this area. As of now, 4-5 cities, Bengaluru, Pune, and Mumbai and Jaipur and Bhopal. So these 5 states, they have come up with their Rabies Free City initiative. In this initiative, we are partnering with the corporations to provide the dedicated funding and to have a operational plan with One Health approach in collaboration with the human health sector as well as between the animal husbandry sector. Hello, am I audible?
Yes, ma'am, you were audible.
Sorry, I think it was disconnected. The Rabies Free City initiative is a very ambitious plan, and we are consistently in touch with the concerned corporations, and we are regularly having meeting with them to have this operational plan. But there is some challenges in implementing, because few of the corporations, they are having sufficient funding available to undertake the dog vaccination and dog sterilization. But few of the corporations, they are still having lack of funds and lack of resources. But we are trying to partner with the donor agencies to secure the logistic support to undertake this activity in the cities. The scanning of the media and rabies case investigation is also one of the very important activity by Center for One Health National Rabies Control Program Division. Whenever our media alert is there, we activate the state rapid response team and district rapid response team to have a thorough investigation of that case. Time to time, we send the team from the Center for One Health to have a case investigation. And also recently what we have done, because there were certain reports of the failure of vaccines, the so-called failure of vaccine and death due to death despite giving vaccination. So those cases has been fully investigated. Even the samples were sent to the Central Drug Laboratory at CRI Kasoli. But fortunately, we have not found any kind of issue with the effectiveness of vaccine. But still, this is these sort of activity, these sort of newses in the media, they are on radar, and we are constantly keeping a track and fully investigating and telling the states that there has been, if there has been any issue. So this is one of the key activity which we are taking at the Rabies Control Program Division. Next slide, please. Next slide. This is one critical issue which we try to address at our level. We holded a national consultation on the issues pertaining to human and dog conflict. The slide has been put. So few issues were raised. So that is under discussion with the concerned authorities and concerned stakeholder. And apart from this, we have released many IC material and technical resource material which is freely available on the NCDC website. So this is all from National Rabies Control Program Division. Thank you, and over to Dr. Debelina, please. Thank you very much.
Thank you very much, Dr. Simi. In spite of your program going on, you have spared our time with us. We have enlightened us. Thank you very much. With our previous speaker, Dr. Thinley Bhutia, we saw some technical glitch, experienced some technical glitch. Now Dr. Thinley has rejoined, so we will go to his presentation directly. Dr. Thinley, please unmute yourself.
Yes.
Yes, please start his presentation.
Yeah, so sound off. Hello.
Yes, sir, we can hear you. We are starting your presentation. Now
Share the
it's
presentation.
visible.
Yeah, sorry.
Yeah.
Extremely sorry for the fiasco. So I've covered this, and go to next slide, please. Yeah, I'll quickly run through my slide. I won't take much time. So scenario in early 2000, before we started the program, the situation was really chaotic in the state of Sikkim. In a just population of just 4 lakh, at least one to two human deaths were reported annually. It was such a pandemonium stage in the state of Sikkim, and there was no official reporting system of rabies cases. And if you look at the figure in 2004-5 alone, there are altogether 853 suspected rabies cases, animal rabies cases, and 17 animal received post-exposure prophylaxis, and altogether the doses were around 8,502. And you can't believe in 2004-5 alone, as I said it before, the brutal shooting of mass dog, around 3,000, more than 3,000 dogs were brutally shot. And due to that, vets have a bad reputation. Instead of saving lives, we were, called as, a murderer or something like that. So the situation was really very chaotic, and there was poor animal welfare and public health issue, unmanageable dog population because dogs were brutally shotted. They perceived all people with the gun and all, with sticks and with umbrella. They perceived human as a threat, and there was a huge dog and a human conflict, and huge economic losses from rabies and dog bite in the state. So, we did a calculation. It was the rabies burden before Sarah was approximately calculated, whopping 4 crore. This is exclusive of Delhi, the disability adjusted, the Delhi figure. We have not incorporated that. So the situation is really chaotic. And there was huge economic losses. Yes, next slide, please. Next. Next slide. So, and I would like to highlight few achievements of Sarah, of Animal Husbandry Department, Government of Sikkim. And we are the first state to officially ban mass shooting of dogs. And officially, we have notified that no more mass shooting. Will take up, mass dog vaccination and animal birth control program. Previous slide, please. Previous slide, please. I have not finished the previous slide. Yeah, and we're the first state to implement animal birth control rule. Up till now, we have sterilized more than 130,000, and we have vaccinated more than 4.5 lakh animals in the state of Sikkim, and we're the first state in India to notify rabies as a notifiable disease way back in 2015. 2015. The reason for us to notify rabies as a notifiable disease was something, we were continue to do that, conventional animal birth control program and mass vaccination. We have not factored in other aspects, which will come, I'll explain you in details later on. So we're the first state to start a mass dog vaccination program, which is being done annually based on WHO recommendation since 2010. And we have a trained, dedicated, highly competent team, and we have trained almost 150 vets, paravets, program manager, and human dog handlers from across the country. Vets from Kerala, vets from Madhya Pradesh, vets from Assam. So we trained them as a master trainer. So. And in 2017, we came up with that. We enacted our first dedicated statutory rules called the Sikkim Preservation of Rabies-Free State Act, where we have the salient features are notifiable disease, responsible pet ownership, and a lot of things we have kept that provision. So. Almost for 10 years, we haven't had any rabies cases, any human rabies death in Sikkim. And then suddenly in 2016-18, there were 4 to 5 suspected deaths in the state of Sikkim, and none since 2019. And we have multiple static and mobile veterinary units running in the state of Sikkim. And we have recently inaugurated a dedicated Sarah Hospital and Regional Center for Rabies Control funded by the state government of Sikkim. And we have recently introduced RST, that is rabies surveillance tool, where we can track and monitor the rabies vaccination. It's called rabies vaccination tracker, vaccination sterilization tracker, bite case tracker, and so on and so forth. Next slide, please. So after all these years, we have managed to control rabies, and there's mass reduction in both human and animal rabies and another zoonotic disease, and huge economic savings. In 2000, before the program started, the burden was whopping 4 crore of rupees, and without factoring in the tally, and with mere of 30 to 40 lakhs, we are saving human lives. We are providing jobs for numerous vets and paravets. We are also there's a huge positive impact on tourism sector, because tourists and the travelers, they can safely visit and track all across the state, because the incidence of rabies is low. And another very pertinent positive impact is human values and ethics. In 2004, before the program started, dogs were brutally shot dead, and now we have embarked upon this human and ethical and comprehensive dog population management. Now, a lot of there's overwhelming positive response from the public for undertaking such human holistic, and people are really coming forward and helping this program. And of course, there has been significant reduction in manpower requirement, especially the veterinary service vets and paravets, because earlier, before the program started, rampant rabies cases, animal rabies cases, the people and the vets and the paravets had to go daily for post-exposure prophylaxis, and we used to depute whole team for mass slaughter of dogs. Now, overall, there has been positive impact due to this program. Yes, next slide, please. Next slide. Yeah, and you must be wondering what magic we have with this program. Apart from 3 M's, this is money, material, and manpower. It's very important to have a political will. All the political dispensation right from 2005 till now, we are getting tremendous support, help, from the political dispensation. And there's been, due to our program, due to human approach, the public are participating, they are willingly coming forward and helping this program. And another very important aspect is a dedicated manpower. We have the best team in the northeastern part of the country, where we have a dedicated and highly skilled manpower. And other than these 3 elements, we have other core activities or core elements, especially education. We continue to do mass awareness program right from 2004. We are continuing to do during our mobile field camp. We continue to do education program, very important. And of course, we have legislation put in place. We have requisite infrastructure, logistic and holding facilities, rehoming center in the state. We have provision for rescue and rehabilitation measures for all the dogs who have to fend for themselves in the street. And we have ongoing training to the vets and paravets of the State Department, and there's the involvement of volunteer. We invite foreign vets, Indian vets to help us, and it's a reciprocal thing. They come, they learn, they teach us, and they learn something, new techniques from us. Yes, next slide. Next slide, please. Yeah, so this is something which I would like to share with my fellow vets, and it should be a routine practice. This is something we have incorporated in our NAPRI document, and these few points, please remember, you have to implement this. I've highlighted this, but before this, the SERA main success relies on few things, like for prevention and control of this infection and contagious disease. There are, in the vet's perspective, there are 4 major, pillars. For example, biosecurity, biocontainment, surveillance, and resilience. surveillance, active and passive, and the resilience is through vaccination. There's active immunization program. Apart from these four pillars: biosecurity, biocontainment, surveillance, and resilience, and we harp on two PN, what you call PNP, that is prevent and predict and prevent strategies. We have mastered this art. Over the last 15, 18 years, we map out the hotspot areas. The hotspot areas particularly lies in the border areas and in the low-lying areas where there's a major fire. So we predict, we map out the hotspot areas and implement all these, pre-rabies outbreak, measures. So for example, mass dog vaccination, massive awareness, massive animal birth control program, so and so forth. So apart from these four major pillars, we have to rely on predict and prevent strategies. This is working very fine with us. Yeah. So as per our routine protocol, any rabies probable or any suspected rabies cases or rabies human cases, we immediately debut our rapid response teams, and potential dogs and unknown dogs are quarantined in government facilities, and they are given post-exposure prophylaxis. And very important aspect is to trace in contact animals, because it spreads like a wildfire. If one dog has been bitten or potentially exposed to rabid dog, and that will create a havoc. So it is very important to trace that in contact animals, get hold of it, keep it in our facilities, and start post exposure prophylaxis. And all the own dogs are should be placed effectively quarantined in their home premises and start PEP. And what we do is we restrict movement of all dogs. There is and we have banned introduction of new dogs until the threat is contained. And immediately, as per the provision of notifiable statute, we immediately transmit the information to the health department for informing that there has been a case of rabies, suspected rabies in that particular area. So the medical fraternity, they immediately keep enough stock of anti-rabies or both active and passive immunization. So again, panchayat members are made responsible to monitor, strictly implement the mass anti-rabies vaccination. Gram Sabha, Gram Sabhas are conducted immediately, and awareness programs are given for all the pet owner relevant stakeholders, and we carry out active and passive surveillance, and routinely we collect brain tissue of suspected probable rabbit animals, even wildlife, especially jackal and scan days. Yeah, next slide. So I would like to, this is something, I would like to really share with that, you can't sit idle. You have to continue to invent and reinvent, search and research. The conventional way of doing things, okay, only animal birth control program, mass dog vaccination, mass awareness, responsible, pet ownership may not work sometimes. We have experience, after that incident in 2016, 17, 18, where 4 to 5 human deaths were, suspected human deaths were reported. And we have, we did a kind of a study, and we have found a fascinating observation, and this is something which I would like to share. I have shared this with other people also. Now it has become a working document, and most of these human deaths were reported in April and May post winter session, and jackal and dog bite incidents were active during winter. Why? Because in winter there were forest fire incidents everywhere during January, February, because in low-lying areas we have large monoculture tree plantation, especially the sal forest, and they are very prone to fire. And the habitat of jackal gets disrupted. They move to human habitation and get into contact with dogs and domesticated animals. This is something which is we have observed. So the interface between jackal and domesticated animal was generally reported during winter months. When there is scarcity of food, which further triggered avoid food conflict and territorial competition. And during winter months, as I said, the forest fire that in turn may be reducing the availability of food for native carnivores, which encourage wildlife incursion into villages. And the dense monoculture sal and other pine tree in low-lying areas, which is prone to fire. And every winter there's report of forest fire, and this is also affecting our native animal food sources, and is exacerbating, the what you call the habitat disruption and food conflict, so and so. And what you call, due to, again, we have observed this due to family fragmentation. Some members of the family reside near the forest. As a result, they become more vulnerable to wildlife conflict and rabies. And not only that, Sikkim is strategically placed. We are surrounded by 3 international borders and 1 state, and possible, these all incidents, 5 suspected human deaths were reported along the border areas. So, and we have some kind of presumption that, due to possible use of pesticides in, tea gardens. I mean, the Darjeeling is famous for tea. They may be, using pesticides in some areas, and the low height of the tree bushes, in Darjeeling district, and it doesn't make a good habitat for wildlife, especially jackal. And these animals may be transmitted into Sikkim, as the habitat here in Sikkim is more pristine because we are organic state, and it's not conducive habitat in West Bengal. So these incidents may have occurred, in the background of complex, socio-ecological, environmental interaction. Yes. Next slide, please. So, and this is something, again, one must learn from our experience. And this my presentation mostly revolves around experience based rather than evidence based. So we have had a huge challenge in 2016-17 and encountered a lot of problem, because amid all of a sudden 4 to 5 human deaths were reported, and all of a sudden we didn't know how to begin with, how to start, how to research and reinvent our new strategy. So challenges, and this is something for for pan-India. Sikkim alone cannot, or the Kerala alone cannot eradicate and contain rabies until other states and other agencies, they start this kind of similar program, and we have faced a huge challenge, challenges for maintaining rabies from dog-mediated rabies. These are like absence of SERA, like, the program like SERA in adjacent countries, states, like you don't have comprehensive, state-wide program. And we have, like, for example, I've said it, we have natural borders, and it's all like porous with West Bengal, and there is what you call rampant economic development, because economic development is desirable, but huge, destruction of environment leads to wildlife habitat disruption, and this may be leading to what you call sylvatic cycle of rabies, because their jackal habitation is, disrupted, because jackal, we have observed in 2015-16, the mere perpetrator was jackal. This apex predator, they move to human habitation, they get into conflict with dogs and other domestic animals. And other challenges we face is increasing human population, more dogs, more irresponsible pet ownership, and fragmentation of land. They start living around the fringe area of forest where you have wildlife. And it's difficult to enforce, and statutory, whatever law and whatever legal provision is difficult to again enforce, And we have observed that due to non-reporting of potential animal rabies to health department, there was no response from them, and this may have led to dog-mediated rabies in 2015 and 16, and 16 to 18, and there were a few animal bite clinic, but it was bit unfunctional, not functional up to the level what we should have. And of course, complacency is again another factor we have observed in 2016. 18, because people, when you don't listen about rabies deaths, people tend to forget, what to do, what not to do, because complacency factor plays an important role, and we have to keep creating awareness among youth and young children. And they sometimes they forget to vaccinate their own dogs. When they are exposed to potential rabies dog, they fail to report to human hospital, and they don't receive proper what you call post-exposure prophylaxis and so on and so forth. So these are the challenges we have encountered during 2016 and 18 when we had human rabies deaths. Next slide, please. Yeah, so this is take home message, key lesson learned over the last 18 years, and we are focusing on this, these lessons. There's a take home message for everyone who are interested, who are willing to take up this, challenging, but it's rewarding. So One Health approach is essential at all levels, and active surveillance needed. Of course, passive is also needed. Not to forget, rabies is not doesn't happen in isolated places. It's a transboundary disease. It can happen all across the state, all across the country. So you have to get yourself prepared. And regional approach and collaboration, networking is very, very important. If you don't have proper legislation like responsible pet ownership, mandatory annual vaccination against rabies, you don't have legislation, you frame the legislation and enact in your respective state. And of course, this is predict and prevent strategy. You have to map out hotspot areas and take preemptive measures. And detection of early warning signs, very important. And over the last 18 years, we have mastered this art. And of course, you have to understand the dynamics of the disease through proper monitoring and community involvement through CAP survey, if even lab facility is not available. And of course, tracking, monitoring process through regularly and timely communication with all stakeholders, especially on One Health approach, foresters, medical professional, police, public, very important. And of course, there's a need to strengthen veterinary institutions and manpower. If you don't have skill and dedicated manpower, and the program will not succeed. So you have to have a dedicated skilled manpower, and of course you have to have 3 Cs like communicate, collaborate, coordinate with all stakeholders. It should be a routine practice, and during an outbreak like situation, you have to come up with some kind of notification or common instrument where the roles and responsibilities of all respective stakeholders should be clearly defined. So during an outbreak situation, which entity or which department or which people or stakeholders should take up post mitigation measures, and so on and so forth. Next slide, please. This is my last slide. I'm almost done. Next slide. Yeah, develop a disease response plan and protocol. It should not be just a knee-jerk response. You can't keep, you can't sit idle. You have to continue to do all the elements, whatever you have in the project. So, of course, vigorous mass anti-rabies and dog population management through spaying and neutering. We have to achieve this, this magic target above 70% of the percentage, in a given geographical area. We have to cover at least more than 70 to 75 population. If you can't reach this magic figure, it will certainly fail. And simultaneous work on wildlife rabies, very important. The jackal, they are rabies reservoir, synthetic form of rabies, and of course we have to now start implementing oral rabies bait vaccine. Once you get the license, we have carried out a pilot project. It really works. So laboratory and active surveillance capacity to be developed and expanded. And of course, one very important aspect, because children are receptive, and we have introduced this lesson and chapter of animal welfare and rabies in primary education, and all the stakeholders, especially my veterinary fraternity, please introduce animal welfare and rabies lessons in primary education, because children, in the earlier slide also, my fellow vet, the FC said that more than 60% of the the human rabies deaths are reported in children, because they don't report any dog bite cases to the parents and teachers, and the distance between and of course they get bitten on their face, and the distance between side of the bite and the brain is very short, and children, what we call this vaccine doesn't work sometimes. Of course, you have to establish and strengthen checkposts and quarantine center. Of course, proper garbage management, very important. More garbage, more dogs. Responsible pet ownership is another aspect. You have to make people aware of this pet ownership. Tell them about the importance of having good dogs or a manageable dog population. Even if you have a pet dog at your home, the pets are not a pain. They are part of the family. They get rid of the rats and vermins, and makes your home lively and lovely. So until and unless people are not made responsible, they will not vaccinate and take care of their dogs or cats. Yes. Next slide. I think I'm done. Thank you very much for your patience. There was a power cut here in Sikkim. We are experiencing severe weather, storm and rain, and internet is a bit shaky here. Thank you very much.
Thank you very much, Dr. Thinley. In spite of all these severe weather and power cut issues, you have shared your valuable time with us to enlighten us. Now I would like to request our Joint Secretary Livestock Health, Sarita Chauhan ma'am, to give the closing remarks.
So, first of all, thank you all for those wonderful experiences that you have shared. And I guess we have learned a lot, and every stakeholder has some or the other important learning to take back home by this interaction of not only just experience but ideas, and also the first-hand, experiences and actions which are carried out. So while we have a situation in the country where a lot needs to be done, we also have, on the other hand, states like Sikkim, Kerala, Goa, who have set example in the control of disease of the rabies. And all along these presentations, one adage that came back again and again to my mind was prevention is better than cure. Cannot be more underlined in this case, in the case of control of rabies. And I am given the responsibility of winding up and mentioning about the key learnings, the takeaways that we have from this webinar. So we all agree on the often stated ways and means of controlling the disease. So Louis Pasteur invented this vaccine in 1885, and today we are here in 2024 still not able to make the best use of that vaccine. So first of all, we must all accept it as a failure of the coordination which is required amongst all the agencies. Awareness is of course one of that, which we all felt that needs to be emphasized again and again. So taking one by one, I would say that the important points which are highlighted are basically that the ground level surveillance has to increase. We have to engage deeply with institutions and organizations at the national and international levels. The NCDC is doing its job through the NAPRE and SAPRE. Each state has to formulate an action plan for implementation. This is at the national level and international level, where adequate scientific means and support is also available. As we heard Dr. Sharada also elaborate that how our laboratories are not only helping the country but our neighboring countries, the whole region, in with all the necessary support that is required. But the action obviously lies with the at the field level, and for implementation of that field level, educate, vaccinate and eliminate was mentioned by Goa, and how they have been able to actually do it more with trying to see that the ingress of the virus is also. So now we, as they could vaccinate all their dogs, the focus which is now there on the ring vaccination is emphasizing the need for all the neighbors also to cooperate, and therefore it has to spread to the neighboring states, or as underlined by Sikkim again, that it cannot be a standalone activity. It has to, all of us will have to work for that together. Now talking about Kerala, what we like the best thing about Kerala was the patient counseling being institutionalized. Patient counseling which is institutionalized, which is another very good aspect, and the way they have also included the private participation, training of the dog catchers and vaccinators, and recording of the data of vaccinated dogs. These are important aspects which will help us in actually put in action the whole activities that we need to do, and the micro planning which is required, for which the state plans are very important, and they need to work on those. Talking about Sikkim, I would say Sikkim has made much of the work, that we need to, collect about the information, etc. Easier for all of us, in the sense that the experience which has come out from the One Health kind of an approach which they were forced to, and on the other hand, what I find is that Sikkim was pushed to such a state, as they expressed, where the humans had actually turned so inhuman, and that is what we have to watch out against, because we are sitting at a point where these kinds of actions may be resorted to by many more such sections of the society, and therefore the example of Sikkim is something to learn from, and how particularly the involvement of the the urban local bodies or the Panchayati Raj institutions, and the continuous vigil that is required, which was of course underlined by all the three presentations and also by the scientific presentation. And we at the Department of Animal Husbandry, as the secretary herself mentioned, we will be organizing a workshop to see that the most important stakeholders in this, which is the urban local bodies and the Panchayati Raj institutions, with them along with the state governments and the experts in the area, so that this aspect is focused more where it requires the maximum attention from, in terms of efforts, in terms of coordinations, besides of course the society at large, institutions who work in this area. SARA is one we've seen, we saw one from Goa also, and Kerala, working with the private institutions and organizations which are able to create a balance between care for the animals and at the same time concern for the humans. And in all this, I would say I'm really happy that Dr. Thinley, Dr. Murugan, Dr. Ronnie and their teams who have like warriors against these, and they can be used as resource persons for more and more training of by the national institutions like NCDC, also in the preparation of the action plan, because what we require is more of such examples and very structured ways of dealing with it, as to providing actionable points to different levels who are involved in this. And last but not the least is the people, the owners, the pet owners, as well as individuals who need to know how to behave, how to interact with the dogs also. And at a larger level, I think Sikkim pointed out towards the manner in which we need to actually do the development when it comes to whether the economic development is crossing its boundaries, whether we are crossing onto the habitats of certain, and on the other hand, we are also feeding to such change in the habits of eating of the dogs, etc., or of any other animal concern. So a balance which is required in the human in the behavior at a larger level is of course also underlined, and this enriches us a lot, and we will this only gives us also direction in order to achieve what we need to by through the MDV. More than 80% of the MDV, the awareness in the schools is something which cannot be more underlined, and every year the interaction in the schools as conducted by Goa is something which needs to be institutionalized. Also the syllabus, the state councils for education and research and training to include it in the curriculum. It is high time, and it cannot be more opportune time, and now that it is becoming an urgency every year, and we have to take a vow, as the secretary started with, that we all of us have to take a vow, and taking from the education department's line of each one teach one. I think each one of us at our own place can be at least making someone around us aware of so many things in so many ways, whether scientifically giving arguments or by giving examples from how things are done, and also the healthcare which is to be provided to the those who are bitten by the dogs or other affected animals, and the animals themselves. So that is for the veterinary sector to take care of. With these words, I think we have adequate ammunition in our to go ahead again with a renewed vigor, and to see that this is not lost. It is not a knee-jerk reaction, of course, and it's a continued effort, because it doesn't. It affects us in many ways, and we deserve to give ourselves much better life and existence along with the animals. So thank you all. Thank you very much for this wonderful interaction.
Thank you very much, ma'am. Concluding the event, I will like to request Dr. Sujit Naik, Joint Commissioner, Livestock Health, to deliver the vote of thanks.
Thank you, Dr. Devlina. On the event of tomorrow is World Rabies Day, so it's a very nice meeting, rather presentation which has enriched us. So I'd like to thank Secretary Ma'am, 8th Sir, JSLH Ma'am in particular, and also JS Admin, who have for taking the initiative of creating the awareness about rabies, which we know is 100% fatal, but at the same time it is 100% preventable. So I would like to thank our esteemed speakers, Dr. Sharda, Associate Professor KVFSU, Dr. Murugan, Director Mission Rabies, Dr. Narendra Naik, Assistant Director Government of Goa, Dr. Thinle Bhutia, Additional Director Sikkim, Dr. Ronnie Ray, Assistant Director Kerala, Dr. Simi Tiwari, Head Center for One Health and CDC. And all the stakeholders who have joined us online. It had crossed 300 at some point. Thank you all for being there, and I'm sure that people from laboratories, states, animal welfare boards, and our colleagues here in the room, I want to thank all. And also we have learned a lot about advocacy, enhanced surveillance, training, and very interestingly children's awareness, which is very important. So I would also like to thank Dr. Devlina to conduct the meeting in a smooth manner, though we had some hitches on the side. And also thanks to the audiovisual committee room staff and other support staff. So thank you, ma'am, again, and I would like to thank you for joining with us again.
Thank you very much, sir. With this, we are concluding our today's webinar. Thank you all.